Hi, everyone. I want to talk about COVID, its effect on the brain, but in the context of what's called cumulative brain injury. So we've had many people come here, got COVID, got POTS or whatever, okay? And that's what this case is we're going to talk about. And when you start talking to the patients, they've actually had autonomic dysfunction before. So it's not all from COVID. COVID is just one on top of other injuries. Now, these injuries you can get here from physical concussions or subconcussive events, emotional traumas, simple surgeries, fractures of bigger bones. That would probably be hip, pelvis, maybe humerus, and then COVID and sometimes vaccines if you have a strong response. Now, if you have no chronic inflammation in the body, that's the blue line. You get an injury, you recover, back to baseline. Injury, back to baseline, so on and so forth. When you have chronic inflammation, you get an injury, you kind of may feel better, but you leave a little bit behind here. And now each injury, this starts worsening, okay? And you'll see this, and I see this is most everybody's history. They just don't understand like things in the past and how these were related to low blood pressure. And that's of that point is the two main mechanical problems people experience that cause their symptoms when they get a concussion is injury to the autonomic nervous system, and one is it results to low blood pressure in the brain, so you don't get enough oxygen in the brain. Think anxiety, poor focus, ADD, brain fog, hyperactivity. So you have low blood pressure of the brain, and then you can have slowing of the intestinal tract. So think, dysphagia, heartburn, reflux, bloating, constipation. Those are kind of the two mechanical things that happen. Now, so this young girl presently is almost 16, and her history is when she's a little kid, elementary school kind of age. We had a lot of GI issues, food intolerance problems, nobody could sort it all out, headaches and some anxiety. So she was probably already food intolerance. So like, I can't eat tomatoes or spices, like things like that, is often from SIBO. All right. Now, food intolerance such as I go into shock if I have peanuts is a different thing. All right. But this kind of nuisance level stuff is often SIBO. And so she was having inflammation back then, and kids, they get bumps on the head, they get scared or bullied, sometimes they have their appendix out or something, they get some vaccines and so forth. So there's a lot of these little injuries that are happening in people, and they're starting to build up. So in this, she originally was just having some headaches and anxiety, maybe a little hyper, and then by the age of 11 is the first time when she's really lightheaded and has a couple episodes where she passes out, okay? It's called syncope. And so then in a couple more years after that, so this is 2023, she gets COVID, not particularly sick, but definitely had COVID. Now, COVID causes a big surge in inflammation, okay? You get a sinus infection, the systemic inflammation goes up a little. Influenza, quite a bit more than that. COVID, huge compared to those, okay? And that surge in inflammation will actually injure your brain. And they've shown this in animal models. I mean, they were talking about damage you can see in a microscope. Now, if you have this surge of inflammation and you don't have, and it gives you a brain injury, but the inflammation goes away, you can repair out of this, okay? But she's had this problem for a long time. She's had SIBO for a long time. So the mom starts a protocol with fish oil and olive oil and some inulin. Inulin kind of helps, okay? If inulin makes you feel better, you probably have SIBO. Now, inulin doesn't work well in adults, but in the kids it might. So they come and see me. We switch her over to fish oil and olive oil and continuous rifaximin. So that's 550 milligrams twice a day, just nonstop. And so that was last March. And already, I saw her about 2 weeks ago. All the POTS symptoms are gone. Her blood pressure symptoms are better, tachycardia is better, no more headaches. Now, premenstrual syndrome and really bad cramping. So premenstrual syndrome is a low blood pressure issue, so that's gone away. Dysmenorrhea, where you have really bad cramps, that's often related to SIBO, that had gone away. And so pretty much everything was gone except for certain foods were giving her a true kind of histamine-like reaction. A little flush at times, sometimes a little itchy. She would get that. And this is a reactivity so around the small intestine, you have about 70% of all your white blood cells, including your mast cells. And I've seen this where her leaky gut has stopped. Okay, how do we know? Well, I should add, we have SIBO. Why? Because she responds to rifaximin. That's the only thing rifaximin will treat. So if you take rifaximin, you get better, you had SIBO. Discussion over. And if you can reduce inflammation enough to get the brain to recover, you're going to do better. Okay? And so I know we had stopped the leaky gut, and the inflammation's come down substantially. Why? She recovered neurologically. And so there is some data that you could still have maybe the vagus nerve not working correctly, and all these white blood cells that wrap around the small intestine are regulated by signals through the vagus nerve. Okay? And it's actually the way it happens on the ear. The signal goes up in the vagus nerve to the brainstem, and then signals flow back down through the vagus nerve and the spine and help regulate those white blood cells, including the mast cells that's triggering this kind of high-V kind of reaction. And when we added that, so she got the Vitality Smart Cable, 5 minutes once a day. We used 5 hertz, and they said within a couple days it was different. It stopped. Okay? So she's doing great. All the symptoms are recovered. Now our next goal is how do we get her off of some of this stuff? She's going to stay on the fish oil and olive oil because that's really a function of the food supply and how kind of messed up that is. We're going to wait till maybe Christmas and stop the rifaximin and see if she relapses or not. And by looking at her SIBO fingerprint, which is basically this reactivity to lots of food and so forth, her food intolerance. And then, if that's good, then we'll probably stop the vagus nerve stimulator, and we'll see how that goes. So, a little case of just how cumulative brain injury leads to this process, and you can get one more little or major injury, and it looks like the whole thing just falls apart. But when in actuality, you've had this kind of low blood pressure kind of symptoms maybe for a few to several years prior to that. So, all right, everybody, have a great day, and take care.